If you have any questions and you want to ask, please just raise your hand, and we'll do our best to get to everybody that has a question.
I do have one to start with. I hope it's okay if I hijack this for a minute. What has been asked to me, I talked to a lot of you guys. I talked to a lot of the benefit administrators. I feel like this is really too high. Let's see here. About the affordability and how to get a little bit more creative in making the premiums a little bit more affordable for your employees. So a lot of it is, hey, what are other units doing? How are people getting more creative? And I brought that back. And so, Chris, if you want to go into a little bit about this, really has more to do with the unit and how creative they can get with that as far as those premiums go.
That's right. We wanted to share an idea that we do for our employees, and it's patterned after a program that's in place through the SEIB and also through PHIP for the teachers, and it's a federal poverty level employee discount. And I've got a slide prepared to show how this works. So it's based on a sliding scale of the federal poverty level, and you can see if you're over 300% of the federal poverty level, there's no discount. But if you're between 100 and 300%, or 0 to 300%, the discount range goes from 10% all the way to 50%. And the way this looks with actual numbers is on this second page. And the discounts are based on the total family size and the total household income. So you can't just do it based on what your employee makes. We take into consideration the entire household. So we ask for just a tax return from the previous year. And you can see it, the amount of the discount varies based on the family size and the amount of the household income. So this is just an example of something that you can do for your employees. It's an easy way to it's an easy thing to put into place, and it gives you a standardized program to help your employees out. And if you have any questions, we'll be glad to answer those.
All right, I'm going to start off with a couple of the questions that were submitted to us, and then as you guys have questions, please raise your hand. So the first question we got was, when and why did the transfer rules for new hire enrollment change? Seems there is no longer a benefit for those coming from a local government agency.
So I'll take that one also. We changed that last year, and it was an effort to make things a little bit more standardized. As we move forward with a new enrollment system, we're going to be more automated. Automation is great, but automation does not like special rules. And so this was an effort to just make everything across the board be the same. So for those that are first day of second month, that resulted in that gap period that we talked about earlier. But again, the employee would be eligible for COBRA in that situation.
All right, another one we've got is, I have a lot of employees that complain that the insurance doesn't cover for eye exams and such. Our employees have to go with another insurance company to get glasses, contacts, etc. I'm going to turn this one over to Jessica.
So this is a perfect opportunity for us to communicate. One of Blue Cross and Blue Shield's partners, Blue 365, they have a discounted eye network that will help you cover the cost of eye exams, glasses, contact lenses. So please go to Blue 365 to look up the Vision Discount Network. I think we have flyers on that over at the Blue Cross and Blue Shield table too, where you can get eye exams for $50. So you can go on there and search the providers in your area that participate and print out that coupon and take that to your eye doctor, and they will honor that.
Yes, ma'am. So the question was when you enroll somebody online through MyLG HIP, there used to be a button that has no email, but now it is gone, and it requires you to put an email in. And she was just asking if that was coming back.
Well, moving forward with our new enrollment system, it will all be email address driven. Furthermore, a lot of our correspondence and communication about our benefits and programs are sent through email as well. So we're trying to capture those email addresses for your employees so that we can communicate more benefits to them. So that's why we did it. We would like for them to have an email address so we can correspond with them, communicate with them quickly, efficiently, and so that's why we're trying to capture that.
We're also trying to capture the preference of an employee. Going forward, we'll ask you, do you want to be communicated with via email or via text? And so almost everybody's got a cell phone. And so when we can get that option turned on, it'll make it a lot easier to get that needed communication to your employees.
All right, we got a few that were submitted yesterday. Actually, said we have a retiree that is currently on retiree insurance that is almost eligible for Medicare. What does he need to sign up for with Medicare, and what does he need to get to you to keep his retiree insurance? But also have the correct Medicare coverage, and his wife will be eligible for Medicare after him. Does she need to follow suit?
Okay, when the employee becomes Medicare eligible, they will need to purchase Part B, sign up for Part B, and start paying for that. And then we will move them to United Healthcare coverage. So your employees that are non-Medicare retirees, once they become Medicare age, they'll need to get Part B so that we can move them over to, well, they'll have Part A. You automatically get Part A. You sign up for Part B, and you'll receive a lot of correspondence about that as you reach that age of 65. So if you are on the non-Medicare retiree coverage, when you come close to 65, you'll want to get Part B, so that way we can automatically enroll you into our United Healthcare coverage.
And one thing to point out on that, if you're an active employee, you become Medicare eligible, you need to enroll in Part A until you retire, and then when you retire, you'll have a special enrollment period to where you can enroll in Part B. So you wait until Part B until after you retire, but you need to go ahead and enroll in Part A even though you're still actively employed.
And there is no charge for Part A. And I can testify that as you approach that magical retirement age, which I guess is not a retirement age anymore, but you approach 65, you will get mail, email, text messages, phone calls. I don't know how they found out how old I was, but everybody in the country wanted to offer me Medicare insurance.
And then the second part of that, the spouse needs to do the same thing when they reach 65.
All right, another question that we received was, are there going to be any new Medicare benefits that are going to be rolled out for the new year? And nothing's going to change on the Medicare side for Medicare retirees. So United Healthcare will still be in place, and all of those benefits will stay the same.
And I think she's coming to speak.
And so Kareen's going to be speaking to everybody this afternoon as well about United Healthcare and their benefits.
But there are CMS updates. There are changes in the Medicare benefit that's provided to members via the Medicare program, and so everybody ought to know that. And there'll be there are already communications out there about some of those changes. They're not changes that we administer, but they are changes that affect retirees.
That's right, and I believe Kareen's going to tackle that subject this afternoon.
Questions from the audience?
This information right here, on the screen, it is in your presentation. But if you will talk to me off to the side, I can email you a link, because this is based on a policy that is in place for the State Employees Insurance Board, and they actually have this information on their website, so I can send you a link to that website.
Yeah, there's criteria you have to meet in order to get the preferred premiums. The most significant one is your 80% wellness screening, and Jessica can talk a little more about that. But every screening year, you have to make sure you get at least 80% of your active employees screened during that screening period. And the current screening period ends on
July 31st.
July 31st. So August 1st through July 31st is the wellness screening period. I know it's confusing. Our fiscal year is September. The plan year is the same as the calendar year. The screening period is in July, but a lot of dates.
But tell about the other.
The other criteria are if your unit offers retiree coverage, there is a rule that at least 5% of your population has to be retirees, but there's a caveat, and there's a way around that. If you certify to us, and if you offer all of your employees who retire during the year, if you offer them retiree coverage and certify that you offered them coverage, then you don't have to meet that 5% criteria because some retirees may not take the coverage and go elsewhere. So there's really no reason for a unit to be standard because of that, as long as you're at least offering coverage to the retirees throughout the year. I think the last criteria is you cannot be late on 2 or more of your monthly premiums within a 2-year window. That's another reason signing up for ACH is so vital, because if you are late on 2 or more premiums during a 2-year window, you're going to go to standard for the rest of that plan year as well as the next 2 plan years. So if you're late in January, you could be in the standard category for about 3 years. If you do fall into that, if you do get behind and you're late on 2 or more payments, there's a way around that. You can sign up for ACH and you will not go to standard. So if you sign up for auto bank draft after you've been late 2 or more times, you can stay in the preferred category.
Yes, you can send them to a network pharmacy to do a free screening, the health department, and we'll even come out on site if there's enough people that need a rescreening. But remember, it's calculated based on your percentage on July 31st. So even if you had 90% participate in March, if you hire, fire, retire, or somebody expires, that's going to affect your percentage. Okay, so make sure you have a good buffer in place and don't wait to the last minute, because it's calculated your percentage as of July 31st.
And just to make sure everybody understood what her question was about when you have new employees that start, how it does impact those wellness percentages. Hey, real quick, Jason, do you mind repeating the questions when people ask them?
Yes, ma'am.
Thank you.
Yes, ma'am. So she's asking what's considered late when it comes to having late payments and it applying to your preferred rate.
There is a 30-day grace period for being late. So if you go over those 30 days, you get what we call a strike. And essentially with this, 2 strikes, and then you would go to standard. So like Michael Scott said, fool me once, strike 1, fool me twice, strike 3.
Let me talk about that a little bit too, because sometimes we've had units have a unit administrator leave and somebody steps in to take over and they don't know all the things that go on that person's desk. And they might miss the fact that you need to sign on to our website, look at your invoice, get the bill paid. And so sometimes it just happens. Not that people intended to be late or intended not to pay their bill, they just weren't aware. And to Dustin's point about using ACH, if you'll use ACH, it'll never get overlooked. It'll never be accidentally not paid. And when you consider the cost of the difference between preferred premiums and standard premiums, and consider the fact that you pass on some of these premiums to your employees, it's a tough penalty. And so we hate to see it when it happens accidentally, hate to see it any time at all, but if you can go ACH, if the monies are in your account predictably, that's the best way to do it so that you don't run this risk. And we've got great participation in that ACH program already. And so if you need help there, Dustin will get you signed up this afternoon.
Absolutely. And if you do sign up for Auto Bank Draft, your premiums are going to come out the first business day of the month of coverage. So for October, they would have come out, I think October 1st was a weekday. So for your premiums for that month, they'll come out the first business day of that month.
So she was asking about new employees and getting wellness checks and in the time frame for that.
If you have new employees that are hired after your screening event has taken place, so the end of the wellness period is July 31st. If you have your screening event in May and you hire new employees in between that time, you're going to want to get them screened so they can go to their doctor, a network pharmacy, or we can come out and do screening events, or you can go to the health department. So there's different options, but I would get them screened if they're going to be counted against you.
The question is, if you're paying online through your MyLG HIP account, is there a way to not pay the full amount due? Can you break down the premiums and pay them separately? The answer is no, that's still the same. The way around that is you can mail our office checks and our accounting team will deposit them, or you can call our accounting team over the phone and we will be able to take that payment over the phone for you.
The question is, how is the 80% calculated? It's calculated using just your active employees. So early retirees and spouses do not contribute to that 80% calculation.
She asked how many people you had to have a unit or to be on our plan, and we've had them as little as one. Yes, ma'am.
No, spouses do not count, but we do encourage them to participate.
So the question is does the number of participants have an influence on how much you pay in your premium?
No, it does not. You just want to have the 80% to qualify for the preferred premium discount. So if you don't have that 80%, you'll be a standard rate for the next calendar year.
Jason, I wanted to point out before we leave this slide that these federal poverty level discounts are updated every year. So this is the 2024 information. If you're interested in this program, make sure you Google federal poverty level guidelines, and you can find it on the internet pretty easy. And it will show up just like this. Well, without the discount information. But you will see the family size and the income in a chart similar to this.
So is there anybody out there that wants to ask any other units how they do what they might do? If you have a question about something, a process that you're doing today that you think you might be able to do better, do you want to ask what other people are doing?
Do any of you have any unique things that you do to increase participation in your wellness screenings? So you make it a big event and you invite other vendors and you make it a big deal and then have giveaways, drawings. Yeah. That's good.
Why don't we do giveaways?
All right, so now that Jessica's opened that door, it is time for my annual disclaimer that these wellness screenings must be considered voluntary under federal regulations, okay? And there are guidelines out there as to what voluntary is. When the regulations were originally put in place, you could do a financial incentive, and the financial incentive, I think, was as long as it was less than 30% of the total cost of the premium. A couple years ago, there were some cases that did away with that financial incentive language, and the federal agencies have not put any new language in that place. So without any additional guidance, I can say, you can kind of rely on that as a guidepost, but I would definitely consult your legal counsel or before making any decisions, because they do need to be voluntary.
Sometimes we get caught up in these requirements and we miss the why. And every year when we do these wellness screenings, people find out things they did not know. Oh, my blood glucose level is high. I need to go see my doctor because of my blood pressure. And so these things come up in these screenings. And if you read our mission statement, it's about offering an affordable, robust health plan and improving the lives of our members. And when we can help somebody become aware of something early on from annual screenings before it gets to be a big, full-blown problem, then we're doing something for our employees and our members. And that's where the true value and it's really what the thinking was behind the wellness program initially. How do we keep costs low? By getting people to understand what their health risk factors are and get treatment early on before the risk factor gets out of control and causes lots of other things. And so if I was selling my employees on it, that would be my point. We're interested in improving your quality of life, and we're going to pay for this screening for you, and it's painless. And so that's the real focus here. And I think we ought to keep our eye on the prize. And that prize is, I helped you become aware of something that you wouldn't have otherwise known about.
And I found out that there's such thing as good cholesterol and bad cholesterol. They told me your cholesterol is low. I said, well, that's good. One less thing to worry about. And they said, no. You have good cholesterol and you have bad cholesterol. Your good cholesterol is too low. So therefore, your overall cholesterol is bad. So hence why I'm an accountant, not a nutritionist. So anyway, now I eat almonds, handful of almonds in the morning and afternoons, and that's helped.
So the question was the information that we gathered out front when we asked you guys what you guys pay towards your employees' benefits and what the employees pay. He's asking if that could be shared just as a whole, not necessarily broken down by unit. But I'm gonna let Chris answer that.
Yeah, we can take that back, and we can probably blind the data and send it to you, and then send you just aggregate what those percentages look like.
So the question is anybody doing the temporary employees when you're an ACA unit, and how you guys are doing that as
Well,
far as
Yeah, I hope that anyone with more than 50 employees is doing it. If you're not, you need to start. But come see me. I've got some slides that I can share with you. Then I'll be glad to share those with you.
all right. Well, we're going to wrap it up, and we greatly appreciate your time and your questions. If you have other questions and didn't want to ask them, but you want to ask them one-on, all of us are going to be over there. Feel free to come over there and talk to us.